Good morning, everyone. Thank you for joining us. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take a moment to click some buttons to make sure that all of the media have joined us, have permission to record. You will have permission to record this briefing. We are also recording, and that video will be made available on the Health District's website later this afternoon. So give me just a moment. Okay. I should have given everybody permission to record, but if for some reason you have issues, please send a chat in the chat box to the Joint Information Center, and I will go ahead and get that fixed. Today, we're joined by Snohomish County Executive Dave Summers, Snohomish County Department of Emergency Management Director Jason Biermann, Snohomish Health District Health Officer Dr. Chris Spitters, and Dr. Adam Jonas, District Medical Director with Snohomish Kaiser Permanente, Washington. Each of our speakers will give an update, and after all of our speakers have shared their remarks, we'll be taking questions using the chat feature. Please be sure to submit your questions to everyone so that all of our speakers can see. Thank you for joining us, and with that, I'll hand it over to Executive Summers.
Great. Well, thank you, and good morning, everybody. Thanks for joining us. Hope you all had a restful Memorial Day, and a special thanks and very grateful for all the county staff and others who worked over the holiday. These include corrections folks, public works, deputies, park rangers, facilities, DEM, just a number of employees that kept the county running and working over a very busy, I'm sure, holiday weekend. So thank you for keeping Snohomish County working. Appreciate it very much. We also announced yesterday that Snohomish County will be creating a memorial for veterans that we've lost in post 9/11 conflicts. This is going to be part of Holler Bridge in Snohomish County, and Snohomish County Arts Commission has chosen a local artist, Carolyn Sumter, to work with veterans, family members, and others to design that memorial. And we plan to dedicate the new installation on Memorial Day 2022. So look forward to that. So in regards to COVID, past year and a half, we've really been focused on two primary needs: getting resources out to those in need as quickly as we can, and also ensuring we're being wise stewards of public funds. And this is regarding supporting our communities during this pandemic. We were really careful with funding to ensure we could adapt our response as needs arise. So we wanted to take a thoughtful but careful approach also. Because we've taken that care, this week we plan to fund more of those who applied to our R3 grants for small businesses, but who have not yet received funds. So we have some funds remaining that we're proposing to go out to those R3 applicants. We're really able to do that because we were careful, and now we can help more businesses that were impacted by COVID-19. So we'll be hopefully reopening that program later this month. And by reopening, I mean we are going to fund down or fund businesses that applied earlier but were not funded in those rounds. So we'll be taking from the list we have. We're not reopening applications, but we will be funding businesses that did not get assistance earlier. So, we continue through the pandemic. We're continuing to try to help our businesses, our communities in recovery, and look forward to getting those dollars out to small businesses. So with that, I'm going to hand it over to Jason Biermann of our Department of Emergency Management.
Thanks, Executive Summers, and good morning, everyone. Thanks for joining us. I have just a couple of updates on the vaccination efforts in Snohomish County, and then I'll be turning it over to Dr. Spitters and Dr. Jonas. I want to say that overall, we are still seeing good progress in Snohomish County with people getting vaccinated and increased protection throughout the community. More than 25,000 people got vaccinated between May 18th and May 25th, and over 16,000 got their first dose of a 2-dose vaccine regimen. So still quite good numbers of folks who are going out and getting vaccinated. I had mentioned last week that we were going to start transitioning from our mass vaccination sites and that they would begin to wind down and that we would begin to increase focus on community-based clinics. So those clinics include vaccinations at schools, and I want to highlight the first school clinic vaccination done by the task force took place last week at Explorer Middle School in Everett. Most of the vaccines that we provided were for folks who were aged 12 to 15, but we were also able to vaccinate other community members who either had waited until their children were eligible or came in, a family member who needed a second dose and had been struggling to locate one. So all in all, we were able to get 235 people vaccinated at that event. And that's the type of local community access that we're really striving to get now and make possible for everyone. We know we're still just one piece of the puzzle. There are other providers and other organizations that are working to provide vaccines at schools, at churches, community centers, and anywhere that it's easier for folks to access. And so we're going to continue to do our part. And for community-based clinics that are being staffed by the vaccine task force, there is a calendar online, and I think Heather can share the link in the chat. There it is. There is a calendar online. It's on the mass vaccination page. It has schedules and a registration link for these and for the mass vaccination sites. But speaking of the mass vaccination sites, after today, we will no longer be providing first doses of Moderna, and fairly soon we'll be issuing the last first doses of Pfizer. We're going to continue second doses for all the folks who've received a first dose from us, so we'll at least continue to provide second doses to ensure that folks have the opportunity to get their second dose. But as I mentioned last week and want to reiterate again, we are starting to scale back our operations at our mass vaccination clinics in favor of the community-based clinics. So if you haven't gotten your shot, there are still lots of places where you can get vaccinated. Your clinic, your pharmacy. We do have other events this week. There will be Aqua Sox games today and tomorrow at Funko Field. And for people who get their first dose at an Aqua Sox event and then come back for their second dose, the Aqua Sox are offering vouchers for 1 free game admission and 1 free hot dog. So we've got some cool events coming up. We've got other events planned that are on the calendar. Just want to say we're really grateful for all the partners in the community who are helping us make this happen, and for everyone who's actually going out and getting vaccinated. Like I said, we still have large numbers of folks who are, and that's good news. We're not out of the pandemic yet, but everybody doing this helps us get there. So we are heading in the right direction. And with that, I'm going to turn it over to Dr. Spitters.
Fantastic. Thanks, Jason. And thanks, Executive Summers. Good morning, everyone. I'd like to start this morning by sharing some exciting news on behalf of one of the Health District's programs. Last week, the National Association of City and County Health Officials, also known as NACCHO, announced their 2021 Innovative Practice Award winners. The awards this year recognize programs developed in response to the COVID-19 pandemic that demonstrate effective community partnerships, collaboration, adaptability, program resilience, and remarkable innovation. The Health District's Child Care Health Outreach Team was honored to be one of the 33 local health department programs in the nation to receive an award from NACCHO this year. Winning projects were determined through a competitive peer-reviewed process, and our team was selected for their work creating an online training course to disseminate accurate COVID-19 guidance practices for child care providers caring for children across the state. The course not only provided upstream prevention strategies for controlling the spread of the virus in a child care environment, but participants received in-service credit for taking the course to contributing toward annual in-service credit requirements for licensing. The course was launched in May 2020 and has been completed by more than 3,000 users. This includes child care providers in nearly every county of Washington state. That was 35 counties out of 39 to be exact. Thanks to a partnership with the American Academy of Pediatrics Washington chapter, this course is offered free of charge for all child care providers in the state to ensure that financial or geographic barriers do not prohibit providers from accessing this learning. Our child care healthcare outreach program is a multidisciplinary team of health professionals, including a public health nurse, environmental health specialist, a nutritionist, and a behavioral health specialist. This program has been providing health and safety services to child care providers in Snohomish County for over 20 years, and it is one of only 4 such programs in Washington. I'll also add that it was one of the pioneering such programs back when it started. As a bronze awardee, the program will be receiving a $2,000 award for services from Contact World, a technology and public health communications company. They also received 1 complimentary registration for the annual NACCHO conference being held virtually this summer, and their program will be highlighted in a video for all attendees at the conference. This is quite an honor for the Health District, and I'm incredibly proud of the team's innovative work that benefits not only Snohomish County, but our entire state. In other COVID news, we shared some preliminary vaccine data in a press release on Friday of last week. It showed that our younger population has been quick on the uptake. In the few weeks since Pfizer vaccine has been authorized for those 12 and up, now up to 27% of those 12 to 15 years of age in the county have initiated vaccination as of May 27th. We also provided an initial analysis of vaccination by zip code. While there are some limitations in the quality of address information and in the use of zip code data to assign a city to vaccinees, these rough estimates do provide some helpful information for us and the vaccine task force to inform our evaluation and planning efforts going forward. We'll be finalizing that vaccine demographics report and posting it online in the next day or 2 under our COVID vaccine icon on the snohd.org website. Through May 27, here's the summary on the county's global vaccination figures. Fully vaccinated individuals, 346,000. That's 49% of eligible people 12 years and up. Partially vaccinated, 82,000, 12% of eligible, for a total of 428,000 who have initiated vaccination. Again, that's 61% of the eligible population and 52% of our total population. All age groups over 16 years of age had at least 49% coverage for initiation. That ranged from 49% in the 16 to 19-year-old population up to 75% in those over 65 years of age. Intergroup proportions addressing racial and ethnic groups showed decreasing gaps between Latinos and other groups, now up to 44% having initiated. Native Americans, 51%, Blacks, 54%, White, 50%, Asian, 71%, and Pacific Islanders, 81% having initiated. Lastly, given the holiday weekend, we do not yet have an updated case rate to share, that 2-week case rate that updates us through the prior Saturday, but we should have that published online and through the Health District's social media channels either later this afternoon or tomorrow morning. Now I'd like to provide a warm welcome and introduction to Dr. Adam Jonas. Dr. Jonas is an internal medicine specialist and the district medical director with Kaiser Permanente in Everett. He has been both a frontline care provider and a key team member in the county's work group of chief medical officers convening throughout the pandemic. He's here this morning to share more with us about how Kaiser Permanente is helping with their efforts through their system and around the county. Adam, welcome. It's all yours.
Great. Thanks very much, Chris. I appreciate the opportunity to join the group today. So Kaiser is one of the many sites that you can get your vaccine at now. And I would, just start by encouraging people to spread the encouragement about getting vaccines. You can, for Kaiser, we sign folks up either through a phone number or online, and we are offering vaccines primarily through our Everett clinic, but we also have them at our clinic in Marysville and at Smoky Point. And I'd encourage folks to take advantage of any visits to the clinics to get their vaccine if they have not, because what we're finding now is that as opposed to a few months ago, we have more vaccine than we're seeing demand now. So we're very anxious to get folks vaccinated, and we're doing it for people who just want to walk in and get their vaccine, as well as people who are visiting the clinics for other reasons. And we are seeing that because a lot of people are vaccinated and restrictions are starting to be relaxed, our demand for services in our clinics has gone up in most cases 50% above what's typical for this time of year. So it's a great opportunity for people to come in, get some health needs met that maybe they've been delaying doing, and getting their first dose of vaccine along the way as well. I would note too that we are expanding a variety of ways to get healthcare too, looking forward to what's happening going forward. A silver lining of the pandemic has been an acceleration of other modes of care delivery. So video visits, phone calls, chat, both synchronous and asynchronous. So I see that moving forward as a way to also continue protecting our communities so that folks who don't need to come into a medical center are able to get their care needs met through the most efficient and effective way, and don't necessarily have to take any additional risk by being out in the community, especially for our older patients. And I would also mention that I still am seeing, as a clinician, I work an average of 2 days a week in the clinics or in the hospital, including Providence and Everett. And I still see folks who are on the fence or have not gotten their vaccines. I worked at Providence just last week, just finished a rotation there. And I saw an elderly woman in her 80s who hadn't yet gotten the vaccine and got sick with COVID, ended up in the hospital. Fortunately, she did well, and we were able to safely discharge her. But, I think that was potentially avoidable stress on her and her family. She was very anxious to get the vaccine when she's recovered from her infection. I've also seen some folks in the clinics who have a lot of misgivings, and I understand that a lot of people feel uncertain about the vaccine still, whether it's because of the emergency use status or because of information they're getting from a variety of sources, or the timeline that the vaccines were developed and deployed. And I'm encouraging everyone that I see, both in my professional life and personal life, to either get the vaccine, or if you have questions, really talk to your doctor, talk to your nurses, your nurse practitioners, your physician assistants, any of your care providers that you see, and ask us about it, because I think we can provide a lot of reassurance and answer your questions. In my mind, there's really no question that the vaccine is safe and effective, and really the best way to get ourselves back to the way things were prior to the pandemic. And so please talk to us, me, Dr. Spitters, any providers that you see, and let us help you make decisions about getting the vaccine. Thanks, Chris.
Thank you, Dr. Jonas. We'll start the clarification for Jason. Just clear, are all mass vaccination sites now winding down in Snohomish County?
Yes, so in the sense that we're scaling back the number of days and the number of appointments, yes. They're all, they've all seen significant reduction in folks who want to make appointments. So we're scaling back the number of days that they are going to be open. We will still have sites that we can either operate intermittently as need arises, or stand back up quickly if we need to do multiple sites. But kind of overall, yes, all of the sites are winding down in the sense that there will be less availability through those sites.
Thank you. Okay, for Dr. Spitters or Dr. Jonas, King County says it has cases of the India variant. do we have cases, and if we know it's the 0.1, 0.2, or 0.3 variant?
Sure. So, and there's a variant report published weekly on the State Health Department's website. And the report through last Wednesday, I think it was, shows 93 B1617 variants throughout the state in 7 counties. The vast majority of those are in King County, but Snohomish County had 7, and that's cumulative. And this variant is associated with the widespread transmission in India now, but like other variants, it's planes, trains, automobiles, people move around, and so do the strains move with them. So we'll see how this one competes with the B117 and the P1 that are the dominant strains now in Washington State. One mitigating bit of information about this strain, and really all the other circulating variants, is that although there is reduced susceptibility of these several of these variants, like the B1351, the P1, and now the B1617, to neutralization in the test tube with antibodies from people who have either had COVID or been vaccinated. In clinical practice, the efficacy of the vaccine they're using there, which is the AstraZeneca, it's India's version of the AstraZeneca vaccine that Europe is using. They are seeing, good clinical efficacy in the folks that do get that vaccine.
Thank you. And for Dr. Spitters, last year there were concerns about how the holidays could influence the spread of the virus. Do you expect that people going out this Memorial weekend will have a negative impact this year?
Well, only time will tell. It depends on how it was done. Outdoors better than indoor, and spaced out is better than crowded together, and vaccinated is much better, much better than unvaccinated. So it just depends. You can imagine scenarios where you stack up a few negative factors there and have an indoor gathering without masks among unvaccinated folks, and you might have some problems. Whether that's enough to have a negative impact community-wide, we'll just have to see.
Okay, and this is for everyone. How might the geographic data that we have influence the county's approach to getting more folks vaccinated? Who wants to try that one?
Well, I'll take an initial shot at it, but anyone can feel free to chime in. Again, these are crude estimates. The range is roughly, I think, at the low end in the high 40% coverage of the population of a particular city having initiated vaccine. The high end is in the high 60s. So there's nowhere that's really way far behind. So there's not like an urgent, zone of remedial need out there. But it can tip the scales as where we try to conduct some of the work that Jason's group is doing, and I think he'll have some comments on that, as well as where community-based healthcare providers might look at providing capacity for immunization.
Yeah, Dr. Spitter's covered it well. It's really, for us, it's another data point to look and see if there are gaps that we've missed, if there are folks with whom we need to communicate maybe differently, or talking to providers just to encourage vaccination. So it's another way for us to look and see, if there are any glaring gaps as we look at the availability of these community-based clinics, or our outreach, or all of the above. So just another data point that helps us.
Okay. Next one, masking is generally on the honor system, and per ethical behavior around the very young who cannot possibly be vaccinated yet. Is there a concern for the unmasked spreading illness still, and who is really at risk?
Sure, it is an honor system, in essence. I think now businesses and enterprises can choose to vet at the door, who doesn't have a vaccination card, but my sense is that that's not occurring widely and that it is an honor system. And so I think there's two levels of concern there. One, as you mentioned, people kind of free riding who haven't been vaccinated but are either wanting to be unmasked or ashamed to be masked in a setting like that and don't want to be identified as unvaccinated. So off comes the mask. So of course, indoor setting, unmasked, unvaccinated individuals carry some risk for the other people in the building, particularly those who are unvaccinated themselves. There's an area where, we've mentioned before, if proprietors just want to say, well, to eliminate, that issue, we just want you all masked when you come in, and that's a legitimate choice for them to make. And then all of us, I think, as individuals, have to look at whether we're what our risk tolerance is. And some of us are, even though we're vaccinated, would continue to mask and avoid crowded indoor places. Others might feel more comfortable with their vaccination status and not feel dissuaded from going into a grocery store or a shopping area or what have you because of that.
Oh, Dr. Jonas, did you have a?
No, I would just add that as far as the people who are at most risk, it's clearly the unvaccinated who have risk factors, whether it's age or other health-related risk factors, and I think in the interest of protecting them, I agree with Chris, we would hopefully default to people wearing masks indoors in higher risk situations.
Okay. Is there any update on clinical trials for vaccinating kids younger than 12?
Still ongoing. I think they're talking about, you have to, when you run these clinical trials, you have to encounter enough events. In this case, events would be cases of COVID. And so it's challenging in a setting of decreasing morbidity to run these clinical trials, because you have to get enough events, as they call them, to have statistically significant differences between the vaccinated and the placebo groups. So I think they're predicting being able to report on results sometime in September. And if everything were to click into place, younger populations might have an emergency use authorization from the FDA and recommendations from CDC, by the fall or winter. No change in that.
Okay, and the last question I see is, are vaccines preventing dangerous illness across the board for all the variants?
Well, I'm tempted to ask you, Adam, how many vaccinated patients have you seen in the hospital?
Yeah, none so far. We have a system that we report cases that could be breakthrough from vaccine, and I'm not hearing of any definite cases that have been shown to have symptomatic severe COVID disease. I haven't seen stats, but everyone we're seeing in the hospital has not been vaccinated.
Yeah, and if you just look at growth, a couple of other kind of big picture things, I think that's the strongest recommendation for a vaccination I could possibly hear. And but other things we're seeing, although we did have a wave of hospitalizations with this fourth wave, still some deaths, but very few compared to prior waves. And then if you look at the incidence of, we've had about 1,300 of these breakthrough cases, as Adam mentioned. That's confirmed cases of COVID in people who are fully vaccinated. Through mid-May, there were roughly 1,300. And when you do the rate, when you calculate the percentage of the 3 million fully vaccinated people in the state at that time, you get a rate that's about 2% of the rate of COVID during that same period in unvaccinated people. So that's 98% protection against becoming a reported case of COVID. So again, just supporting what we've heard from the clinical trials, from what our healthcare providers like Dr. Jonas are telling us, is that this vaccine is very effective.
Great. Well, I think that covers all the questions we have in chat this morning.
Great. This is Heather in the Joint Information Center. Thank you again for joining us today and for all of your questions. We're going to wrap up for this morning, but please stay tuned for future media availabilities. Have a great day.